Big breath, honey. One more, honey. Out. Good. In. Out. In. Out. Okay. Good.
What would you say are the main differences between a family doctor and a pediatrician?
Well, a family doctor looks after the whole family. He or she has the advantage because he knows the whole dynamics of the family, whereas a pediatrician only knows what the parent tells them and doesn't know the whole family as intimately as a family doctor. However, the pediatrician has the expertise that a doctor doesn't have. There's 4 years of training. There's all the patients he sees are pediatrics. All his education after finished training is always dealing with pediatric problems. So as far as expertise is concerned, I definitely feel that the pediatrician has that advantage over a general practitioner, although there are a lot of great general practitioners who do a great job. I think in general, pediatricians will do less investigations and less treatment and certainly less referrals as compared to a family doctor. The bottom line is what you feel comfortable with. If you're comfortable with your family doctor, stay with your family doctor. I'm sure if he or she is good and run into a problem, they'll make a proper referral to a pediatrician. If you rather have a pediatrician and you're able to find one, it's good for you. But on the bottom line, he will not look after you or your husband or the parents. He'll just look after the children.
Dr. Lester, can you give us some tips on how parents should go about finding a pediatrician?
Well, that's a very difficult to answer. But generally, if they move into a new area, they can ask their neighbors or friends who they go to, who they recommend, and they can phone up and see if they're taking new patients. They can also phone the College of Physicians and Surgeons and tell them that they would like a pediatrician in their area, and they will probably have a list of pediatricians. They can also phone the local hospital and speak to the medical staff office, and they will also have a list of pediatricians who are still taking patients. And from there, you make your phone calls and inquiries. First of all, one of the most important things is that if a doctor is usually on time, that you should be on time. You should also organize your questions and write them all down, because I'll tell you for sure, you will not remember them all. They're going to forget, and all of a sudden 4 hours later you're going to get a phone call from the other spouse saying you forgot to ask him this or that question. They should be directing most of the interview to the problem that they want to deal with and that particular child. If there's any tests or anything that they want the results of, they should let the office know beforehand so we could have them ready for them. And if they want to have any other specific information, they should let us know if possible before. If they've already been to a walk-in clinic or someone else who's done testing or prescribed medication for them, we would like to know that before they come in. I don't like when they come in and say, well, he gave us the red medicine or the yellow medicine, because I don't know what that was, or he did tests, but they don't know what it was. It just makes it easier, because as a doctor, I'm like a detective, and I have to learn, have to get all the facts, and unless I have them in front of me, I can't make a proper diagnosis.
Dr. Lester, can you tell me what should a new parent remember when they come in for a checkup with their baby?
Well, they should remember when to bring the baby, that's for sure. Right? To bring in their immunization card, to bring in all the questions that they want to ask me, have it written down, because when they get here they'll forget them all. Have a pencil and paper handy too. When we're dealing with one child, we like to deal with one child, and rather than you come in, we deal with the child and you ask 32 questions about the other child, and we forget about this one child. The most common trend I see now is that parents are very stressed out. they are unable to cope with minor illnesses. They've had unsolicited advice from their advisory staff who give them usually the wrong advice, and they come in extremely worried. They've already may have looked at through the internet and looked up things that are not pertinent to their child, and they come in worried. And I have to spend a lot of time reassuring them that there's nothing wrong with the child. In fact, I spend more time reassuring them that there's nothing wrong than actually treating them. And to me, a dose of reassurance works a lot better than a dose of medicine 99.99% of the time. One of the ways I try to reassure patients is that I've written a book. The book is 375 pages of reassurance. It's in an encyclopedia format, and has answered basically every question that has been asked to me in the last 42 years. It's an excellent source of information, resource, questions being answered, and to self-educate the caregiver if there is concerns or no concerns.